Hello, everyone. Hello, hello, hello. Hi. Hello. Happy Friday. Happy Friday. Happy Friday. Just want to make sure I'm on again. Sorry. Hello, everyone. Happy Friday. Let me see if anybody's watching us. All right. Hello, everyone. Happy Friday. I can't see anyone on right now. Okay, I'm starting to see people coming on. Hello, happy Friday. Happy Friday. You are watching Q&A with Dr. Mercy. Sorry about the delay. There were some technical difficulties, but you are watching Q&A with Dr. Mercy. I'm Dr. Mercy, and just wanted to have us join this conversation. Hello, Mary Johnson. How are you? Hi, Nina. How are you? Hello, Ebony Sanders. Hello, Dr. Tina. How are you? Hi. Hi, everyone. Stephanie. There's a lot of LinkedIn folks. Hi, Keela. Hello, Tamara. How are you? Where are y'all viewing this broadcast from? I always like to ask where everyone's viewing it from. Hello, Ishmael, Pamela, how are you? Diana, happy Friday to you, LinkedIn user. Hey, Nadu, how are you? You're from Chicago. That's awesome. Wow, there's a lot of us here. Hi, how are you? Hi, Dara. LinkedIn user, you're from South Charlotte, North Carolina. Wow, there's a lot of us. Um, so, Mary, you're from Lakewood, California. You're from Washington State. Great. So there's a lot of us here. I wish I could show everyone's where everyone's calling from. Hi, Dr. Tina, or viewing from, excuse me. Wish I could show that. Hi, Matilda, Latasha, you're from Chicago. Farah, hello. Hello, Demetrius, Francis. I'm just scrolling down just so that everybody your art studio, of course. Of course, you're viewing from your art studio. Okay, Erica from Tulsa, Oklahoma. Kenita from Philadelphia. Okay, so we're Bahamas. Albertha Moss. Nice, nice. Well, welcome. So we're in for a treat while I'm just seeing where everyone's viewing us from. Hi, Pamela. Happy Friday. Happy Friday. Hello, Diana, Aisha. Hi, Onyx. Hello, Farah. Matilda. Hi, Maryland. UK. Awesome. That is awesome. Lagos, Nigeria. Wow. Okay. What is it? Time? What time over? Isn't it like 1 a.m. in the morning? Wow, that's pretty cool. Uh, Okay, so you can see everyone's comments. That's awesome. Thank you. So thank you, Mary. So we don't have to scroll through them. Well, thank you guys for joining this today's or this week's broadcast. Again, like I said, I'm Dr. Mercy Ajonwe. I am an internal medicine physician that actively practicing in the great state of Texas. I didn't see Texas here. We usually have some people from Texas, but yeah. So I do this every Friday. Yeah, I thought it was 1 a.m. in the morning, so I was right. Um, I usually do this every Friday, and it's just a way for me to tell our community what are some of the current medical issues that we need to be aware of, and just have an open dialogue. So as we talk about any of these topics, please feel free to write questions in the comment section. As you can see, I'm viewing them, and I'll try to I'll try to answer them as we go along. If I'm not able to answer them, then I may reply back to you. Okay. Also, if you have any, no, Texas is good. Texas is good. It's hot right now, but it is a good state. I love Texas. And you're from Miami. Welcome. So, if you have any questions in terms of what we're talking about, or even if there's any particular topic you would want us to discuss in the next week's broadcast or in future broadcasts, please definitely let me know. So, this particular topic that we're talking about, um, is about sun safety. And the reason why exactly, Pamela, the reason why I'm talking about it is, especially in Texas, we have been going through a very heat advisory. And as Pamela just told us right now, she's in San Antonio, Texas, and it's at least 100 degrees here. And it has been 100 degrees, not only in San Antonio, but throughout the state of Texas. And not even in the state of Texas, Dallas, Texas in the house. Okay, good. Okay, so we do have some Texas folks. Please pray for Maui. Yes, yes, we definitely need to pray. Our hearts and prayers are with Maui, with what's been going on with the devastation. So thank you for that. Yes, let's pray for that. So, anyways, getting back to what we were talking about. So we need to really talk about um, sun safety. Because of what I realized after this past week of being in the hospital, practicing in the hospital, is that a lot of people are coming in due to the effects of the sun. And so, I actually realized this several weeks ago. And so I did my first video on sun safety several weeks ago. If you haven't seen it, please go back to BWE, either in the LinkedIn, YouTube, or Facebook, and just take a look at that. Just gives a clear overview of, the stats and, just a clear overview of how to protect yourself and what you need to look for, especially those with chronic diseases. Now, I'm just going to kind of go further more into the discussion because it is important. Like I said, this past week that I was working in the hospital, a lot of my patients were coming in due to the effects of the sun. So let's talk about it. Let's discuss. So we are currently, or we have been currently, in a heat advisory when it comes to climate. And as you can see, weathers have been very hot, particularly in the US in the southern borders. This is things are getting better. We're seeing temperatures a lot lower, but we are still having, like Pamela said, days where we're seeing 100 degrees, if not more. So it's very important to protect yourself in the sun. And just like I talked in a previous live about heat illnesses, you get heat illnesses due to extended exposure in the sun. So the main two types are heat exhaustion and heat stroke. Heat exhaustion is when because of prolonged sun exposure, you're experiencing heavy sweating, weakness, lightheadedness or dizziness, nausea, and a headache. This is because you're in the sun for a prolonged period of time. Usually with heat exhaustion, if you take yourself away from the sun, if you drink some fluids, those symptoms tend to resolve. It's the more severe form of heat exposure and heat disease is when you go to heat stroke. That is when you now start having confusion. You start feeling your heart racing. You pass out or become unconscious or even develop a seizure. This is due to heat stroke. This is a medical emergency, and it's something where your body is now reacting, and internally you're getting damage as a result of being exposed to the sun. So we talked about this the last time we talked about heat illness and heat stroke. So I wanted to just briefly remind us. So this time around, I want to talk about some of the protections that we should do when we are exposed to heat. A lot of it you guys already know, but just for some of us that may not remember or may not know, I wanted to kind of give us some aspects of what we need to be mindful of. Okay. Let me go to some of these comments, because as I'm reading them, seeing them, I'm reading. Your car read 104 in Jackson, Florida today. Wow. I think the highest my car has read is 106, but 104 is very high. The reason why I'm laughing is I remember I don't know if it was a week or two, I went inside my car, and as I was sitting, I have leather seats. As I was sitting down, just, like I usually do, I had to go, oh, I jumped right out. I was like, oh, and then I looked on my heat thermometer or whatever, the thermometer that you see in this car, and I was like, oh, it was way above 100. So I knew, okay, I need to be very careful from now on and make sure my leather seats are not too hot. So getting back to the presentation, water. If you're spending lots of time in the sun, your body temperature rises. So it's best to just drink lots of water to keep your body cool and hydrated. And this is really important. Like I said, a lot of people are coming in just because of dehydration alone. So they're coming in. The typical scenario that I've been hearing about is, they're mowing their lawn or doing just minimal yard duty, but because it's so hot, they now start to have this lightheaded spells, and some have passed out briefly. And when we check them in the hospital, we see that they're severely dehydrated, and we literally have to give them IV fluids through their veins just to get them hydrated. And yes, Tamara, our elderly can really be at risk during these times. They are, and the reason being why they're at risk, thank you for saying this, is a couple things. My observation is a lot of time older folks, they don't drink as much water. So at baseline, they're already dehydrated, right? And then you couple with that the sun, it's now drying them even further. On top of that, they're on medications such as blood pressure medications that already are, the purpose of the blood pressure medications is to bring their blood pressure down. So you're dehydrated, you have sun exposure, and you are using medications that are already causing your blood pressure to go down. I see that as a triple whammy. And so, yes, they're a very high risk. I used to work with some heart doctors in Tucson, Arizona, because, obviously Tucson, Arizona is a desert, and you will see a lot of people there, especially during the summertime, come in due to dehydration. I've seen where some heart doctors have told their patients during the summer months, half your blood pressure medications, meaning take only half. Like you will want to take half dose of your blood pressure medications. Why? Because they've observed that in the summer months, because they're so dehydrated, the blood pressure medications, the amount that they need to use is less to get their blood pressure in a very more optimal state. So thank you for talking about that. What type of water is best to drink? I always talk about just drinking just normal water. For me, it's just normal water, regular water. And we could talk about that. We could talk about the different types of water. Some may, especially if you have electrolyte issues, you may want to drink electrolyte containing drinks such as Gatorade. But for me, I think it's usually the best is just simple, just H2O. Good evening, Tiffany. How are you? So getting back to this. Uh-oh. Let's go. I don't know why it's taking. I'll go over here. Okay, so let me go back here. Just one moment, guys. Okay, here we go. Thank you. So the National Academy of Science, Engineering, and Medicine recommends a total of, for women, a total of 2.7 liters a day of water. And this includes fluid, all kinds of fluid. So remember, we don't just get fluid in our drinks. We also get it in food as well. And so they recommend that the total amount of water that we need to consume is be about 2.7 liters. This is for women. And this is an average, meaning each woman is different. So this is not the exact number. Depending on your weight and height, and depending on your medical conditions, you may need less or you may need more. This is where talking to your doctor is really important. So to get the context of what is 2.7 liters or 91 ounces, I have with me a bottled water. So let me get it. It is right here. So this bottled water is 16.9 ounces, which is about 17 ounces. So if they're saying that we need about 2.7 liters, which is 91 ounces, they're saying for women you should be consuming total about 5.5 and a half watt of this amount of water, okay? And this is total, okay? But if it's just strictly water, they're talking about if it's just strictly from just drinking water, they're saying you should have about 2.2 liters, which is 74 ounces. And if you were to calculate, that would be about 4.5 of these water bottles. So that's what women should be doing. Let me just move. Okay. Okay. Hey, Raul, how are you? Or I don't know how to say it. It's Joel. So Raul, I'm sorry if I said it wrong, but how are you from the Philippines? That's awesome. I think it's it should be 8 a.m. your time. Great. You had asked a question, Brandy. How do we address middle school, high school athletes who are involved in after school activities / sports? Great question. Well, they should, first of all, drink fluids prior to and even after the activities. So they should keep in mind to always at least drink at least a water amount as much as this, and before and after. And then at the same time, there are ways that you can monitor your body to see if you have enough water intake. So if your pee is clear, like water, you know you're drinking enough water. Okay. If when you look at your tongue and it's glistened because there's some water, it's moist, okay, then you know you're drinking enough water. Even we as physicians, we look at your skin. If as you pinch your skin and you let go and it just bounces right back down, you know you're drinking enough water. If you're not, when you pinch the skin, it'll stay up like this. So there's ways that we can be able to observe in our own body if we're drinking enough water. So for children, it's just to tell them to be very hydrated. Start off with one bottle of fluid before the activity and one bottle of fluid out after the activity. And then start to observe how much fluid that they're taking in throughout the whole day. And that would be great for them. But we could talk more about that in future lives. Okay. You're 5 months in and you're drinking 1 gallon of water a day. How is that for you? What have you observed? I have noticed that when I have increased my water intake, I feel a lot more stamina, energy. I also notice my skin is a lot better. And so drinking a lot of water does help. Also, remember, too much of everything is bad. Just as you drink, just as low water intake can cause symptoms, high water intake can cause symptoms as well. They call that term water toxicity. So you don't want that either. Again, I say stay very true to your body, observe your body, and make sure that you're not having symptoms from any excess amount of water. But it's great that you're drinking water. Okay, I don't know. I don't understand that, but I hope everything's good there. Thank you. Okay, beautiful skin and lots of energy. Great. See, that's what I've observed too. And my hair also has also been more healthier with water too. So that's a very good testimony. Thank you. So getting back to our presentation for men. So we talked about the women. For men, they say that on average, they should have a total amount of 3.7 liters, which is around 4 liters or plus or minus. And if you were to look at that, when you calculate it, that's about 7.5 of these bottles a day. Now, when they say total fluid intake, remember that includes your food, because your food also has water in it. But they also say that, if it's just water alone, they should have about 3 liters. and that's about 101 ounces, and that would calculate to be about 6 of these water bottles. So that's really the requirements. And like I said, each person is different because we all have different body types and sizes. And then, in addition, some of us have chronic diseases. And so, some diseases, such as heart failure, such as liver failure, such as kidney failure, will dictate how much you can and cannot have. With those type of conditions, you do have to now maybe limit the amount of water that you do take. So like I said, talking to your doctor so that know you, that know your body and your conditions will be a good idea to do. And also knowing yourself and seeing, okay, how much water can I consume is a good thing to do when you're talking about how much water on a daily basis you should have. People always talk about 8 cups a day. That's about 64 ounces. When I calculated, that's about 3 of these. Um, mm, that's a good start. That's a good start. But it's not like a one size fit all. But if you're drinking less than 3 water bottles a day, and you don't have any medical issue to why you shouldn't drink more, consider that as your first, guideline, and say, okay, let me try to drink at least 64 ounces a day. And then if you feel like you need to drink more, and it seems like the recommendation is for women and men, you should be drinking a little bit more, then you can gradually go up from there. So, oh, Mobile, Alabama, it's 98 degrees, but high humidity of 100. Whoa, okay. So it is hot. It's hot everywhere. So also when we talk about water, just make sure, herbal teas, unsweetened drinks, they all count towards a water intake. Sugary drinks and alcoholic beverages, alcohol actually makes you want to pee. Even sugary drinks make you want to pee. So there's a counterbalance effect of those. So those would not be my first choice of water. I mean, excuse me, a fluid intake. If I'm trying to um, increase my water intake, I wouldn't be going immediately to the sugary drinks and alcoholic beverages. That wouldn't be on my top list. I would drink the waters. I would drink the teas. And for those of you who say, "Oh, well, I don't like water." Well, right now they have, and I think you guys have probably seen it in the stores, they have these flavory powders that you can put inside the water that can taste like lemonade or pink lemonade, any of those type of flavors that you can use to kind of help add taste to your water. So I recommend those for people who don't like water. But staying away from sugary drinks and alcoholic beverages will help. So now we talk about sunscreen, very important. So one of the misconceptions that a lot of people have is, well, there's two. One is that do we, as people who have melanated skin, do we really need sunscreen? And the answer is yes, we do. Even though we do have melanin in our skin, or higher melanin than others, the melanin does serve as a sun protectant. It's not enough, and there are certain skin cancers that you still can get as a result of exposure to sun. So it's best that everybody actually purchases and uses sunscreen. On top of that, the second thing that I was going to say is, how often should we use sunscreen? Now, it's been said that everyone should be using sunscreen every day. Anytime you are exposed to the sun, you need to be really technically using sunscreen on the sun exposed areas. So it should be every day if you're outside every day or anytime you're outside. And they recommend that you use and then you apply sunscreen 30 minutes before you expose yourself to sun. So let's talk more in depth about sunscreen. Okay. Anytime you want to apply sunscreen, the lotion, to yourself, always make sure you put it in areas where they're exposed to the sun. So that's your face, that's your chest if it's exposed, your arms if it's exposed, your shoulders. And that is to protect yourself from the rays of the sun. Okay. Now, to talk more in depth about it, the sun has two different types of radiations. These are radiation rays that you get exposed to. It's called UVA and UVB. I believe we will talk about this later, but I can talk about it now. UVA stands for ultraviolet radiation. It is the rays from the sun that, if you get chronic exposure to that, it causes a premature aging and it causes skin damage. So you don't want that. UVB is the radiation from the sun that, if you if it exposed to your skin, can cause sunburn. Okay, so a lot of these SPF, which is the sunscreens, are really targeting the UVB part, but there's probably some protective factors with the UVA as well. Okay, and both UVA and UVB causes skin cancer. So when you talk about SPF, first of all, it stands for sun protection factor. You want to have a sun protection factor of 30 in your sunscreen. And this is the level at which the amount of sun protection factor in the actual lotion can block about 97% of UVB radiation to be absorbed in your skin. So at minimum, 30 or more should be in the sunscreen that you end up buying. So I don't know if you can see this. I have a sunscreen here, and it is a sunscreen of 30. So if you go to the next so a lot of this I've already talked about, but when you're choosing a sunscreen lotion, you want to make sure it says specifically on it that it's a broad spectrum. Why? It's both helping to protect from the two UV lights that come from the sun, which is the UVA and the UVB. So broad spectrum sunscreen lotion protects from both of them. Okay, and we already talked about the differences, but all we know that both UVA light and UVB light causes cancer. And that's enough for us, okay? And you want to make sure that these sunscreens contain some other factors as well based on your skin type. So we talked about SPF, and it stands for sun protection factor. We talked about it being 30 or more, and that it protects 97% of the UVB from actually absorbing in your skin. You also, in these sunscreens, you want to see if you can find sunscreens that can contain either physical or minerals in it, such as zinc oxide or titanium dioxide. These are ingredients, minerals that, if you apply it on your skin, they can help to have the UV lights bounce off of your skin, and so they serve as a good protectant. But the chemical that you want to avoid in your sunscreen is the oxybenzone. I'm sorry, I'm tongue twisted today. Is the benzone. The oxybenzone. So the oxybenzone is a chemical that has gotten very bad press because it is actually, when applied to your body, can be a hormone disruptor. What does that mean? That means that it can absorb in your skin and it can disrupt some of your hormonal systems. So they've studied it, particularly in rats, that has been the case, but they've also seen in studies with people who've had exposure to it, that it is found in some of your hormonal systems. So for me, it would probably not be a material that I would like in my sunscreen. When I looked further, they said that there's no conclusion or no conclusionary evidence that it is something to avoid, but anything for me that causes hormonal disruption is no thank you. So if there's a lot of sunscreens out there that you can use. If you can avoid it, that's good. That'd be better for you. Okay, so that would be something that I would recommend. You would want to have sunscreen that's water resistant, and the reason why is if you're going to be out in the beach, or you're going to be out in the pool, you don't want your sunscreen just rinsing off of you. So you want to be aware of that. And then for those who have sensitivity issues with your skin, you want to look out for sunscreens that either are allergenic or fragrance free. Anything that can reduce the number of irritants in the lotion would be good for you. And like I said before, you want to apply sunscreen daily on a daily basis. So it's not just when you're prolonged outdoor activity, it's every day. And luckily for us nowadays, a lot of facial creams or even body creams and lotions actually have a sunscreen applied to it. So it's a lot more easier to get that in the stores. And when you use it, you want to apply adequate amount just to ensure proper coverage. Really look at the back of your sunscreen bottles, because they do a good job of giving you a good direction of how to use it. This particular sunscreen lotion that I do have, it says apply literally 15 minutes before sun exposure. And they also talk about you want to make sure you reapply. Majority of the sunscreens out there want you to reapply anywhere from 80 minutes to 120 minutes, which is 2 hours. Typically, it's every 2 hours that you want to reapply. And then, yeah, they even talk about limit time in the sun, especially from the hours of 10 a.m. to 2 p.m. That is the time where there's a highest exposure to UV light. So if you can avoid being in the direct sunlight and between those hours, the hours of 10 a.m. to 2 p.m., that's better for you. And so lastly, even though you're wearing sunscreen, you still want to wear protective clothing. So anything that can help to protect you from the sun is really advisable. We're almost done. So like I said, or we said earlier in our last part of sun safety, if you can see any shade, obviously you want to be in the shade. You don't want to have direct exposure if you can avoid it. And like we just said earlier, if you can not only use sunscreen, but anything that can protect you from the sun, such as hats, sunglasses, protect your eyes. I talked about it in our last talk when it comes to sun safety, how prolonged exposure in your eyes can cause these abnormal tissue growths into your eyes called pterygiums. So if you can protect your eyes wearing sunglasses, that's also good as well. So what are the types of clothing that you want to use to help avoid getting a sunburn like this, or just help avoid sun exposure? So you want to wear something loose fitting, like something like I have on, because that will allow for circulation in your body, air circulation. And that will allow for, as you are outside, you are also evaporating, you're perspiring, and your heat is coming off of your body, because your body, once your body is absorbs the sunlight, it tries to react by releasing heat. So anytime you're out there and your body's trying to release heat, you want to wear something loose fitting, so as the body's releasing the heat to cool you down, it can fully get out of your body, instead of something like snuggled, and so then you have the heat around you. You don't want that. You want to wear a very light colored clothing, because as some of you guys are aware, colors such as white can help bounce off the UV light from you, rather than dark colored clothes. It kind of brings in the UV light and the sun, and it's just closer to your body, so you don't want that. Kind of absorbs the heat. And then you want to use natural fabrics. So you want to stay with like cotton, linen, hemp. They're very good choices for hot weather. They're very breathable. They allow air to just flow through, and they just promote circulation, air circulation. So that's good. If you can, try covering up, okay? You want to wear long sleeves and pants. And the reason why is it can help with you not getting direct exposure to sun. So The clothing can kind of act as an additional protectant against the sun. So if you could wear those long sleeves and pants. You want to avoid synthetic fabric like nylon and rayon because they tend to trap heat and they make you feel hot and sweaty. And then there's some fabrics out there that call them moisture wicking fabrics, and like polyester blends and athletic wears. They tend to draw sweat away from your skin, and then they keep you dry and comfortable. Yeah, so those are some of the tips that you can do when it comes to clothing. And those are some of the things that you can do in general when it comes to being safe in the sun. So that is my conclusion for sun safety. I did want to just add another topic, which I didn't put in the presentation, but if some of you guys are already aware, in the beginning of this live that I did several years ago, we started talking about COVID, and we've been very consistently trying to monitor COVID. So I just wanted to kind of give you guys an update based on my observation in the hospital. In my area, there has been a slowly trickling of increase of COVID patients that has been starting to arise. And this is just based on the area where I'm at. So I just wanted to say that to have you guys be aware of your locality. Make sure you look and absorb and observe, excuse me, how the COVID prevalence is in your area. So just not only be sun safe, but also be COVID safe as well. Thank you so much, John David, for your kind comments. All right, this is all I have for now. I hope you guys gained some understanding. And until next week, I hope you guys have a very good weekend. Thank you so much. Bye.